Hello, I'm Annette Young and welcome to the 51%, a show about women reshaping our world. Coming up, with Lebanon still reeling from the fallout of that devastating explosion in Beirut and also from an ongoing economic crisis, we report on how access to women's healthcare services is becoming problematic. Plus, as the impact of COVID-19 threatens to derail women's progress around the world, we talk to Professor Linda Scott on the even more pressing need for female economic empowerment. And the young Vietnamese beauty queen who's using her popularity to become an advocate for girls' education. But we begin in Lebanon, where growing inflation means that a fast-growing number of women can no longer afford to pay for specialist medical care as the economy collapses. Doctors are warning that long-term consequences could result in higher rates of breast cancer and other dangerous health conditions. The explosion in Beirut's port was also particularly traumatic for new mothers and mothers-to-be, as Peter O'Brien reports.
Rima Hassan was terrified she'd never hold her baby girl. In the days after the Beirut port explosion, she rushed to the clinic, fearing she'd had a miscarriage.
I haven't slept since the explosion. It's constantly replaying in my head, and I'm petrified there will be another one. I don't feel safe.
She's since given birth with no complications. To help women like her, initiatives like this one have been set up. It's a clinic on wheels in the heart of Beirut. They offer free ultrasounds and tests, as well as hygiene supplies for women no longer able to afford them.
Pregnant women were severely affected by the blast, especially in areas directly hit by the explosion. Some came to us with premature labor, others with bleeding, some were very traumatized.
Of the 300,000 people displaced by the disaster, the United Nations estimates some 4,600 were pregnant women. Even before, Lebanon's economy was tanking and life was becoming unaffordable for all but the country's wealthiest. At her charity clinic, gynecologist Nadine Al-Kassis used to see mainly Syrian refugees with no health insurance. But since the economic crisis hit last year, times have changed.
A rising number of Lebanese women come to seek treatment in this clinic. We expect to see even more of them with the worsening economic crisis.
Today, many women miss regular examinations as well as important procedures. This woman is 8 months pregnant. She should have already had an injection to prevent an immunity-related disease.
بس إنه هيدا شيء أساسي إنه إذا البيبي طلع عنده تشوه.
It's not just childbearing which is affected. Breast cancer incidence in Lebanon is among the highest in the world, and lack of early diagnosis could make a bad situation even worse.
Now, we're more than 6 months into this pandemic and figures consistently show that COVID-19 is much more likely to destroy women's livelihoods. According to data released by UN Women and UNDP, most of the world's nations are not doing enough to protect both women and girls from the social and economic fallout being caused by the crisis. The two agencies tracked measures in 206 countries to see what's being done in 3 areas: those that tackle violence against women and girls, supporting unpaid care, and strengthening women's economic security. It found 42 nations, 1/5 of those analysed, have no gender-sensitive measures in response to COVID-19. Only 25 countries, 12% of the world, have indeed introduced measures that cover all 3 areas. Professor Linda Scott, author of the Double X Economy, is an expert on women's economic development who's spent decades studying the obstacles to female equality, and she joins me now from Boston. Professor Scott, thank you so much for your time. The UN has said that decades of progress in women's rights could be lost thanks to this pandemic. Do you believe we have indeed rolled back some 50 years?
I'm not sure that we've quite reached that point yet, but it's easy to see that if the pandemic lasts as long as people predict it will, that yes, that is a very, very real risk. It's not just about the loss of jobs and hours and pay, which women are experiencing to a greater degree than men. It's the whole issue of childcare that threatens to change expectation, norms, practices in such a way that we would go back 50 years and women would become not only homebound, but economically dependent again. And that's very, very frightening. It is not a matter to be taken lightly.
And this is a global trend, isn't it?
The women's economy has a very strong pattern internationally. It really doesn't vary very much. So we see women clustered in certain industries like retail, services, and education. These have been much more hard hit than other industries in the case of the pandemic. And the inattention to providing high quality, affordable childcare as a matter of economic infrastructure is a worldwide oversight.
But do you think younger women, especially those who are educated and are at the beginning of their careers, are likely to accept this?
I think young women who are at the beginning of their careers, at the very beginning or just now leaving school, are actually at the highest risk of all, because the onset of the pandemic's long-term effects will happen over the next few years just as they're being hired, their pay is being set, and their prospects for promotions and assignments are unfolding. And there's a pattern among employers, a longstanding pattern of using motherhood as a blunt instrument against women. And you do not have to have children for it to be used against you. And so if motherhood is allowed to become an excuse for treating women unequally going forward, it will affect the youngest the most. And these young women need to stand up now or risk losing everything.
What can they do?
One thing that I've suggested in my book is called the 80% Christmas. I think people don't realize that holiday retail is a major part of every nation's GDP and that women control it completely. And if women were to stand up and say, okay, until this is dealt with, until somebody notices that we're hurting even more from the pandemic than men and do something about it, we're going to hold back our spending, and that is going to send the economy to a further tailspin.
In your book, however, you argue, as you've done for many years, that the only way for women to move forward is through economic empowerment, an idea you say has been neglected by many feminists and also largely ignored or dismissed by the men who dominate economic policy. So how do you change those attitudes?
World leaders have a tendency to assume that women's contribution to their economies is trivial, then that their claims are frivolous. But in fact, women contribute about 40% of global GDP. So this is a significant amount of the global economy and should not be taken lightly. The only way, though, that we're really going to be able to get world leaders to pay attention is to raise public awareness. So one thing that women can do is to start speaking out, using social media to make people more aware of the disadvantages that are being exacerbated, for example, by the current pandemic.
You also talk about how to fix the system and that the focus on ways in which women can be fixed so that they finally reap the same economic rewards as men do. But as you say, that misses the point entirely because it's often the men who actually need the fixing.
Yes, this is a lesson that people engaged in women's economic empowerment have learned over and over again. The first impulse is always to say there's something wrong with the women that needs to be fixed. They don't have the skills, or they haven't had the right education, or they don't know how to lead, or something. And research consistently shows that those things just don't have any evidentiary basis, and that if you try to intervene in order to, quote, fix the women, what you inevitably find is that the men are pushing back, or let's be more specific, the institutions the men create are pushing back. And if we don't look and confront the way that some men and most institutions continue to try to do everything that they can to preserve gender inequality, we are never going to get there.
Professor Scott, it's been great speaking to you. Thank you so much.
Thank you so much. I really appreciate it.
And finally, from a tiny village to becoming a beauty queen and now an advocate for education, Yu Han Ni is seen by many as a trailblazer in her native Vietnam. She has defied traditional expectations of women, as Claire Rush explains.
This beauty queen may be off stage for now, but she continues to be a trailblazer in her native Vietnam. 3 years ago, Han Nie tore down a major social barrier, becoming the first woman of an ethnic minority to win Miss Universe Vietnam.
Back in my native village, teenagers like me often bought cream that made their faces become very white. But when my mum gave me the cream, I refused to use it and I ran off to play.
As a young girl growing up in a rural village in the Central Highlands, Han bucked traditional beauty norms, rejecting the skin whitening products that many women across Asia use to have a lighter complexion. As a passport out of her village, where only a local dialect was spoken, she taught herself Vietnamese. She moved to the bustling city of Ho Chi Minh, working as a maid to fund her degree in corporate finance. Now she wants to give back to ethnic communities, and especially young girls, encouraging them to pursue education. According to the World Bank, 74% of children from Vietnam's majority Kinh ethnic group attend upper secondary schools, compared to just 44% for ethnic minority children.
I encourage female students to study better. If they're struggling, I offer to pay part of their tuition fees.
Reportedly on the advice of her mother, Han has poured all of her Miss Universe Vietnam prize money into scholarship programs for school children. She's also raised tens of thousands of dollars to build libraries in Vietnam's rural central provinces.
And that's it for this edition. You can also connect with us via our Facebook page, that of course being France24.51%, or do send us a tweet at _51%. So until our next show, bye for now.